My name is Dr. Usman Siddiqui. I practice electrophysiology. I've been practicing for the last 11 years. Congestive heart failure is a vicious cycle. A lot of patients with congestive heart failure still remain symptomatic despite being on optimal medical therapy, because in frequent number of cases, the diagnosis was made a little late. And if the diagnosis was made late, the tissue, which is already fibrosed and dead, cannot be replaced. What we do know is appropriate medical therapy does improve these congestive heart failures, and they need to be instituted at the right time. If a patient is diagnosed early and we are able to recognize the symptoms and initiate treatment early, we try to optimize medical therapy as directed by our heart failure specialists and have close follow-up with those patients. A lot of times we're restricted with the amount of drug therapy we can give based on patient tolerance and compliance.
My name is Marjorie Hicks. I live in Fruitland Park, Florida. When I first learned I had heart failure, I was 34. I didn't know what was going on, and I always asked why.
I first met Marjorie much towards the latter part of her heart failure paradigm. She had already been diagnosed with heart failure for several months, has been on optimal and the best of the medical therapy, but still had refractory heart failure symptoms. She had been on medical therapy for more than 6 months, and she was referred to me for further management of her congestive heart failure symptoms and to risk stratify her for her risk for sudden cardiac death. When I did meet her for the first time, I immediately looked at her EKG and looked at her clinical picture, and she indeed was in advanced heart failure, class 3. Her ejection fraction was in the range of around 25 to 30%, but fortunately or unfortunately, her QRS was narrow, so she was not a candidate for a biventricular device. I had the discussion of impulse dynamics because I knew with the defibrillator, her heart failure symptoms are not going to improve. She's already on maximum medical therapy.
It's funny, I had a defibrillator that Dr. Siddiqui put in. He said, "I can make you feel better." I'm like, "Oh yeah? Make me feel better? You gonna give me back my life? Okay, give me back my life."
I shared with her my experience with patients with impulse dynamics and how I felt based on her ejection fraction and on her status where she was, that impulse will be a good therapy for her. She decided to go with cardiac contractility modulation, and it proved to be extremely efficacious for her. She was one of our immediate responders. Within a week, she was up walking around. Her heart failure class went down to 1, and her ejection fraction is on the way towards improvement. She has had no heart failure admissions in the last several months and feels really good.
No, I did not hesitate within getting a second device because I trusted Dr. Siddiqui, and I knew that the defibrillator is not going to make me feel better. After I got my optimizer, I started to feel better 2 weeks.
My experience with cardiac contractility modulation has been fantastic. It's a ray of hope for me. I have a large number of patients who have cardiomyopathies, congestive heart failure, who have been on optimal medical therapy, but despite that have refractory heart failure symptoms. Most of them do have existing defibrillators, but they get frequent hospital admissions. Heart failure management requires a teamwork, and teamwork includes a heart failure specialist along with general cardiologists, along with an electrophysiologist.
If I were to tell someone what to do or give them advice, my first thing will say, research, 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 and educate yourself. Find you a good cardiologist team that you could work with.